Welcome everyone to the 50 months progress report. My name is Andrea Lancz and I would like to present my PhD team, which is Management of Itching in the Treatment of Chronic Spontaneous Urticaria and Prurigo nodularis. I'm a second-year PhD student, and in addition, I'm working as an internist and also I'm an immunology resident. I will make my PhD with the help of Department of Dermatology of Semmelweis University. As you can see, I have a lot of helpers. My vision is that patients with prurigo nodularis or chronic spontaneous urticaria could have a better quality of life. Therefore, my mission is to optimizing the treatment of these diseases. Currently, I have two ongoing projects. The first one is about comparing the safety and efficacy of biologics in prurigo nodularis. It is a systematic review and meta-analysis. Prurigo nodularis is a chronic skin disease that usually presents a very intensely itching nodules erupting on the extensor surfaces of the extremities and the trunk. Many related diseases are known. However, it is not clear yet that they are pre-existing or coexisting conditions. Only estimated prevalence is available, but the real number of the patients are probably higher. There are a lot of therapeutic options, but the conventional therapy's effectiveness is questionable, and some of the drugs may cause serious adverse events. In the last few years, new biological agents have been developed, and in cases where the conventional therapies are ineffective or poorly tolerated, the use of biologics has shown promise. So our aim is to identify the best therapy for prurigo nodularis patients. Our clinical question: what is the safest and most effective treatment in prurigo nodularis? Using the PICO framework, our populations are prurigo nodularis patients, and we have compared biologics to the conventional therapies. We have measured the efficacy outcomes and the adverse events. Our hypothesis is that biologics are more effective and safer compared to the conventional therapies. We have carried out a systematic search in the three main databases with these two domains and found almost 5,000 results, which after selection protocol, we had 134 eligible full text. Here you can see my finished analysis. And now I would like to present our newest results. EJE score essentially determine the stages of this disease. So this highlights, this is a very important outcome. The classification of EJE score can you see on the left side of the slide. I would like to present these results in case of dupilumab, which is the first FDA-approved biological therapy for this disease. We have investigated 7 studies with 251 patients, and we have compared the scores before the treatment with the scores after the treatment, and we have calculated the MRO. As you can see, after the prescription of dupilumab, the overall EJE decrease was 3.36, which is a highly clinically relevant and also statistically significant result. It means that the patients who were originally stage 3 or 4 reduced to stage 0 or 1. In our next slide, I would like to present our results regarding the older therapies, the conventional therapies. Considering that these studies are old and the outcomes are very heterogeneous, we have made our own categories based on the published results. Complete response refers full recovery. No response means that there was no achieving or the symptoms are worsened, and the intermediate response, as the means suggests, means the between in the two extremes. We have investigated 8 studies with 137 patients, and in the case, oh sorry, I forgot to mention that we have investigated the phototherapies, and after the phototherapies, 81% of patients achieved some kind of response. However, only 27% achieved complete response, which is neither clinically neither statistically significant result. The other conventional therapies which I would like to present is the thalidomide, which is a widely used immunosuppressive drugs. Our categories was the same as before, and we have investigated 6 studies with 99 patients. However, in these cases, only 64% of patients achieved some kind of response, and only 15% achieved complete response. So this is also not a significant result. After our results, I would like to talk about the strengths and limitations. First, I would like to highlight the strengths. This is a comprehensive analysis of all existing therapies, and we have investigated a wide range of outcomes. But we have some limitations as well. First of all, the studies are very heterogeneous. We have small sample sizes, and there are various definitions of the outcomes. Our conclusion is, based on the results, that dupilumab is a highly effective therapy for prurigo nodularis, and other therapies are less effective than dupilumab. We have some suggestion for practice. We think that we should use the dupilumab at an earlier phase of the disease, and we have some suggestion for research as well. It is clear that we need more comparative studies, especially between dupilumab and other biologics, and we need to investigate the long-term effectiveness of dupilumab and other biologics. Here you can see my progress. There is a vast amount of data which we have to summarize, so there is some work to do, but we plan to submit the article in this February, and our target journal is the JAMA Dermatology. Now, let me back to my second topic, which is investigating the safety and efficacy of chronic spontaneous urticaria. Chronic spontaneous urticaria is defined by the presence of recurrent urticaria or angioedema or both for a period of 6 weeks or longer. It is a self-limited disease in most of the cases. However, patients suffering from this have a low quality of life. The estimated point prevalence is 1%. And the first-line therapy for this disease are the second-generation antihistamines. However, there are patients who have urticaria refractory to this treatment. In these cases, the use of omalizumab are necessary. Omalizumab is the first FDA-approved therapy for this disease. It targets the free IgE. Also, omalizumab has been an important addition for the therapeutic armamentarium for the management of this disease. There are still a significant percentage of patients who doesn't respond to the combination of antihistamines and omalizumab. With the expanding knowledge of the pathogenesis of this disease, new biological agents are in development, and the preliminary results are promising. So our aim is to find the most effective treatment for chronic spontaneous urticaria. Our clinical question is, what is the safest and most effective therapy in chronic spontaneous urticaria? Our populations are patients suffering from chronic spontaneous urticaria, and we would like to compare the novel biologics to the conventional therapies. We will measure the efficacy outcomes with the urticaria activity score and the adverse events. Our hypothesis is that novel biologics are more effective and non-inferior in safety compared to the conventional therapies. Our clinical implication is to achieve the early use of biologics in the treatment of chronic spontaneous urticaria. Our topic is feasible, so the next step will be the Prospero registration. So these are my 2 ongoing projects right now, which we are hoping to submit these in the near future. Thank you for your kind attention. And let me say goodbye with the words of Captain Yemi from Black Clover. Even if you think you might lose, you will be fine as long as you don't give up. Surpass your limits, then a path will open up for you. Thank you.
Congratulations, nice presentation. I would ask a question regarding to your first project. That dupilumab, is dupilumab available, and if it is, what is the cost of this therapy?
Thank you for your question. Yes, dupilumab is available in Hungary. It's called Dupixent, and it's a pricey therapy. The price is dupilumab is £500,000.
Thank you.
Thank you.
I also have a question. These biologics may have complications. So as far as you can see, what is the, for example, in the first project, what is the cost-benefit ratio? Like improvement of symptoms have, yes.
Thank you for your question. Well, the investigated patients have several prurigo nodularis. All of the patients, including RCTs, case reports, case series, if we included them too, are stage 3 or stage 4. So they have symptoms for years. They have many background diseases, and they go hospitals a lot. So I think that an effective therapy from the beginning is very beneficial, including in the costs.
Congratulations for your presentation. My question would be that what do you think is the most important outcome for the assessment of efficacy of the treatments in prurigo nodularis, so the itching or nodule scores, or what would you say?
Thank you for your question. I think the most important, I think we have three very important outcomes. First of all, the reducing of the nodules, the reducing of the itch, and the improvement of quality of life. And I have presented our newest results, but we have fortunately very significant results in these cases too, so I will write them in the article.
So my question is, thank you for your nice presentation. Do you have any own experience with patients with dupilumab in atopic dermatitis?
Thank you for your question. Actually, I don't have much. I'm an internist, so no. I have seen, of course, patients with prurigo nodularis because I recognize them thanks to my PhD. But in my practice, I won't see a lot this kind of patient.
Okay, and it's important to mention that it's first line, as you mentioned as well. We give conventional therapies, and in the second line, we can give dupilumab therapy for the patients with atopic dermatitis. Okay, thank you very much.